I am back. Let us continue. Indicate if you're able to hear me clearly. All right. That's good enough. All right, so it's time to get into trauma. So we'll be covering chapter 13 and 14. Chapter 13, bleeding, shock, and soft tissue injuries. All right, introduction. No, I don't have any info on the books, and I think you probably need to speak with someone from your organization where that is concerned. Damage to internal soft tissues and organs can cause life-threatening problems. Internal bleeding results in shock. Shock is a state of collapse of the cardiovascular system that results in inadequate delivery of blood to organs. When we covered anatomy, we looked at the respiratory system and we looked at the process of respiration. The whole point of getting good respiration and having an effective circulation is perfusion, to get good perfusion, which is the adequate circulation of blood. So perfusion is the exchange of oxygen and nutrients and the removal of waste and carbon dioxide from the cells so that they can carry out their normal metabolic functions. If something interferes with perfusion, we will get what is referred to as low perfusion or hypoperfusion, which is shock. So that is what shock is. It's the inability of the cells to get nutrients and oxygen and remove waste and carbon dioxide so that they can carry out normal metabolic functions. More trauma patients die from shock than from any other condition. Now, in order for there to be good perfusion in the body, the heart must be pumping effectively, the blood vessels must be working properly, and there must be adequate blood volume in the circulatory system, and the respiratory system must be functioning properly. If something affects the pumping of the heart or the blood vessels or the blood volume, that will lead to shock. So that is what leads to shock. Or if a patient is not able to breathe properly, that can lead to shock. All right, now the patient assessment. Follow the steps of the patient assessment sequence. The scene size up needs to ensure safety both for you and your patient. You may need to halt the primary assessment if the patient is losing too much blood. So if your patient is bleeding excessively, you have to address that immediately. And it may mean that that's the first thing that you do before you do anything else, because it's a life-threatening issue at that point. During the secondary assessment, be alert for signs and symptoms of shock from internal or external blood loss. When performing a reassessment, watch the patient for signs and symptoms of shock. Remember, your pale skin means a problem with circulation. Increased pulse is a compensating mechanism for when the blood pressure drops. And a drop in the blood pressure indicates that the cardiac output is reduced. Now, standard precautions and soft tissue injuries. The concept of standard precautions assumes that all body fluids that come from a patient or a person are potentially infectious. Take the appropriate measures to prevent contact with the patient's body fluids. Wear gloves. If appropriate, wear a surgical mask and eye protection. We covered the circulatory system yesterday. So within the circulatory system, there are three components. You have the pump, which is the heart, the pipes, which is a blood vessel, and the fluid, which is the blood and plasma. The heart functions as the human circulatory system's pump. The heart consists of 4 separate chambers. 2 upper chambers on the top of the heart are referred to as the left and right atria or atrium. The 2 lower chambers on the bottom of the heart are referred to as the left and right ventricle. And the left ventricle is the largest chamber of the heart because it does the most work. The right side of the heart is responsible for receiving and distributing deoxygenated blood. The left side is responsible for receiving and distributing oxygenated blood. And there is a wall in the center of the heart that separates the right side from the left side so that the deoxygenated blood does not mix with the oxygenated blood. The pipes, the arteries, A is far away. The arteries carry blood away from the heart with the exception of the coronary arteries, which supply the heart muscle with blood. The capillaries form a network that distributes blood to all parts of the body, and the capillaries are the smallest blood vessels within the body, and it is the connection between the smallest arteries and the smallest veins. The veins return blood from the capillaries to the heart. Now, the fluid, the liquid part of the blood, is the plasma. The red blood cells carry oxygen and CO2. The white blood cells consume. Right, excuse me for 1 sec. Yeah, sorry about that. White blood cells consume bacteria and viruses to combat infections in the body. And platelets form clots that help to stop bleeding. The pulse. A pulse is a pressure wave generated by the pumping action of the heart. In a conscious patient, you can easily find the radial wrist pulse at the base of the thumb If the patient appears to be in shock or is unconscious, attempt to locate the carotid pulse first. We know this by now. All right, now shock. Shock is defined as failure of the circulatory system, and in essence, it is the same thing as low perfusion or hypoperfusion. Circulatory failure has many possible causes, but the three primary causes are pump failure, pipe failure, fluid loss. So there is shock that can affect the heart directly or indirectly. There is shocks that can affect the blood vessels, and there is shock that can affect the fluid, either blood loss or plasma loss. Right now, pump failure, that's referred to as cardiogenic shock. So cardiogenic shock occurs if the heart cannot pump enough blood to supply the needs of the body. And one of the most common causes of cardiogenic shock is a heart attack. And a heart attack is basically a clot that forms within the coronary artery and blocks the blood flow to the heart muscle. That's a heart attack. Now, if a patient or a person gets a heart attack, there are three complications that can arise from a heart attack. One, within the first 2 hours, the patient can develop cardiac arrest, right? So within the first 2 hours, the patient can develop cardiac arrest. 2, the patient can develop congestive heart failure, and this can be dominant on the left side of the heart or the right side of the heart. If it's the left side congestive heart failure, then there is fluid that builds up in the patient's lungs. If it is right side heart failure or right side dominant congestive heart failure, then there is back pressure that is created in the patient's neck veins, liver, and legs. So they can get fluid building up in the legs. And the third thing that can occur with a heart attack is the heart muscle is so damaged that the patient loses 40% of their cardiac output. So that's what we refer to as cardiogenic shock. So inadequate pumping of the heart can cause blood to back up in the vessels of the lungs. This results in congestive heart failure. All right, now the pipe. A pipe failure is caused by expansion of the capillaries to as much as 3 or 4 times their normal size. Now, when it is a shock that affects the blood vessel, it simply means that the blood vessel is too dilated. So normally, when we move about our everyday life, our blood vessels are not completely open. We have good vessel tone, and they change based on the activity that we're carrying out. So a person that's lying down will not have the same blood pressure if they are sitting upright, standing, or running. The body adjusts by constricting and dilating the blood vessels to maintain an adequate blood pressure. Now, if something occurs in the body that affects the ability to do that, then the blood vessels will open completely. And when the blood vessels open up completely in the body, it causes a drop in the pressure inside the vessel, and that will reduce the cardiac output or blood pressure, resulting in shock. So pipe failure is caused by the expansion of the capillaries to as much as 3 or 4 times their normal size. Blood pools in the capillaries. The rest of the body is deprived of blood, and blood pressure falls and shock results. Now, shock induced by fainting. So fainting is a type of shock. It's referred to as psychogenic shock, but it's a shock that specifically affects blood vessels. So when a person faints, the blood vessels supplying the brain with blood temporarily dilate too much. So they are too dilated, and the pressure inside the vessel falls. The person loses consciousness, but as soon as blood flow returns, the patient or person regains consciousness. Now, what is important to note with these individuals is, where were they when they fainted? Was the person in bed? Was the person standing? So we need to rule out the possibility of a traumatic injury. And we also need to find out what occurred prior to the fainting episode. Was the person complaining of a headache, dizziness? Did they complain of their heart feeling funny? So what did they complain of prior to? So that would be classified as psychogenic or psychogenic shock. Now, anaphylactic shock. This is another shock that can affect the pipe. Now, in anaphylactic shock, it is a severe allergic reaction. That's what anaphylactic shock is. Now, when an allergen enters the body, and an allergen can enter the body via inhalation, injection, ingestion, or absorption. So it enters the body doesn't recognize it. So the body records the structure of this allergen and produces antibodies and store these antibodies in the plasma. We call this phase sensitization. Now, during the sensitization phase, there is no physical signs of an allergic reaction. But if this allergen returns, so the body has been sensitized and the allergen returns, the body will initiate a response based on the antibodies that were created, and then we get what is called an allergic reaction. Now, if this allergic reaction becomes systemic, meaning it ends up in the bloodstream, if it becomes systemic, one of the things that occur when there's an allergic reaction in the body is the body produces histamine. When histamine is produced systemically and circulates around the body, it causes the blood vessels in the body to open up. So it causes the blood vessels to dilate too much, and the blood vessels become more permeable. When the blood vessels dilate too much, the blood pressure is going to fall inside these blood vessels, and that will lead to reduced cardiac output or low blood pressure. Now, apart from there being a circulatory problem, histamine also irritates the ear passage. So when histamine is produced systemically, it irritates the ear passage and causes constriction. So two things occur with a patient in anaphylactic shock. One, they can't breathe properly because the airway is too constricted and their blood vessels are too dilated. So it's a terrible shock for a patient to be in. The only remedy to anaphylactic shock is adrenaline. So the patient or individual will need adrenaline or epinephrine. That's the only thing that can reverse anaphylactic shock. If they don't get the adrenaline, it can quickly lead to death. And an anaphylactic reaction is very unpredictable. All right, so we're still on pipe failure. We have looked at fainting, which is psychogenic shock. We have looked at anaphylactic shock, which is a severe allergic reaction that affects the airway and dilate the blood vessels too much. Now let's look at spinal shock. Now what spinal shock is, this is a patient who has received a spinal injury. So the patient has received a spinal injury, but the location of the spinal injury is at a point in the spine where impulses that control the blood vessels are cut off, right? So the patient gets a spinal injury at a point in the spinal cord that cuts off impulses that maintain the tone of the blood vessels. When this is cut off, the blood vessels completely open up and the pressure inside these blood vessels fall, the cardiac output is reduced, and the blood pressure drops. That's spinal shock. So spinal shock may occur in patients who have sustained a spinal cord injury. That's the most common cause. The injury allows the capillaries to expand and blood pools below the level of the injury. The brain, heart, lungs, and other vital organs are deprived of blood, resulting in shock. So that's spinal shock. Right? So let's look at shocks that affect the fluid. Now, with shocks that affect the fluid portion of the circulatory system, it will either be from excessive bleeding, which is hemorrhagic shock, or excessive plasma loss from severe diarrhea or severe vomiting, or a patient with severe burns. So fluid loss is caused by excessive bleeding. It is the most common cause of shock. Blood escape from a wound and the system's total fluid level drops. The heart begins to pump faster to maintain pressure in the pipes, and the pumps eventually stop pumping, resulting in cardiac arrest. External bleeding is easy to detect. We're seeing it. With internal bleeding, it's not that obvious. And as EMRs, there's not much you can do for a patient that is bleeding internally. What is important is that you recognize it. And all you have to do is think about impact points and where there is space inside the body. So if there's an impact point to the head, the brain is inside the skull. That's not a space that can hold a lot of blood loss. So if bleeding starts to occur inside the skull, that's not good for the brain, right? So if a patient has impact point to the head, think about internal bleeding inside of the skull and what it's going to do to the brain. If a patient or a person has impact points to the chest or abdomen, these are large spaces, and these are spaces that can hold a considerable amount of blood. So you should be suspecting internal bleeding. Now for the abdomen, it can be tricky. So the abdomen is a very large cavity, the abdominal cavity, very large. Think of it as a cup filled with ice, right? So the cup is filled with ice. If you pour water into that cup, you won't see the water at the top until the space that is present between the ice fills with the water. And it's the same concept with the intestines inside of the abdominal cavity. So if bleeding starts to occur in the abdominal cavity, it will not be visible until the space between the organs in the abdominal cavity is occupied by blood, and that may be very late for the patient. So if you see a distended abdomen with bruising, your patient probably has bled significantly up to that point. So we're looking for subtle impact points, right? You're looking for discoloration around the navel. You're looking for discoloration over the flank. If a patient gets hit or an individual gets hit in the upper right quadrant of the abdomen and they're complaining of pain in their right shoulder. So they were hit in the abdomen, upper right abdomen, and they're complaining of pain in the right shoulder. That would be a liver damage, and the liver is a very vascular organ, so it can bleed significantly. If they get hit in the left upper quadrant of the abdomen and they're complaining of pain to the right shoulder, that's spleen damage. That's another organ that is very vascular, so they can bleed significantly from that. So just look at the impact points and anticipate internal bleeding into that cavity and recognize the signs and symptoms of shock, relay that early to the responding EMS unit. With internal bleeding, the bleeding cannot be seen, but you may see the signs. So you will see bruising. You can see ecchymosis, or you can see a hematoma. You can see swelling, you can see rigidity in the affected area. The patient will have severe pain in the immediate area. Whether the bleeding is external or internal, if it remains unchecked, the result will be shock, pump failure, and death. An average adult has about 12 points, that's 5.7 liters of blood circulating in the circulatory system. A loss of 2 or more pints can lead to shock. Right? So and just keep in mind that if a patient loses up to 500 mils of blood loss suddenly, they will start to show signs of shock. So we can donate blood. We can donate 500 mils of blood under controlled conditions. But if someone loses 500 mils blood loss suddenly, they will start to show signs of shock. Now, signs and symptoms of shock. Shock deprives the body of sufficient blood to function normally. As shock progresses, the body alters its functions in an attempt to maintain sufficient blood flow. So what does that mean? It means when a state of shock starts to develop in the body has to make a decision, right? So the body has to make a decision. Where can I redirect blood away from, and where do I need to have blood constantly going to? So the body has to keep blood going to the core organs of the body. And the core organs or vital organs of the body is the brain, the lungs, the heart, the kidneys. So the body will redirect blood away from areas that can go without adequate blood flow longer and direct it to these areas of the body. And that redirection of blood flow is what gives us the signs and symptoms of shock. So signs and symptoms of shock include confusion, restlessness or anxiety, cold, clammy, sweaty, pale skin is expected because the body is redirecting blood away from the fingers and the hands and directing blood to the core of the body. So the temperature of the fingers and the hand is going to change, and the color is going to change as well. Because the blood pressure is low, the blood vessels will constrict and beat faster. So you're going to get a pulse that is above 100 beats per minute in the compensating phase. So the breathing will increase to get more oxygen in. The pulse become rapid and weak. There is increased capillary refill time. So there is a delay in the capillary refill because there is not enough blood moving about. Patient becomes nauseous, I should say, and they can start to vomit because the activity of the intestine slows down because there is less blood going to the intestine. They can complain of weakness or fainting and thirst, right? And if they are complaining of thirst, don't give them anything to drink if they are thirsty, nothing by mouth. All right, now general treatment for shock. Position the patient correctly. If the patient has no head injury, extreme discomfort or difficulty breathing, lay the patient flat on his or her back on a horizontal surface, and you may elevate the extremities, and you cover them and keep them warm. If oxygen is available, administer it. Now remember, if we're going to elevate the lower extremity, the patient shouldn't have any indication of a head injury or breathing problems or abdominal issues. Maintain the patient's ABCs. Treat the cause of shock if possible. Maintain the patient's body temperature. Do not allow the patient to eat or drink. Eating or drinking may cause vomiting. Patients in shock may need surgery and should not have anything in their stomachs. Now, assist with other treatments, and this is when the EMS arrives. If you are trained in the administration of oxygen, provide it to the shock patients. AEMTs or paramedics can administer intravenous IV access, and they can give specific medications if necessary. Arrange for transport. Treatment for shock caused by pump failure, and this is shock that is specific to the heart. Pump failure is a serious condition. The proper treatment and prompt transport by ambulance to an appropriate medical facility will give these patients their best chance for survival. Treatment for anaphylactic shock. Patient is going to require transport as soon as possible. Some patients may have an epi auto-injector, so they may have an EpiPen. Support the patient's thigh and place the the tip of the auto-injector against the outer thigh and push the auto-injector firmly against the thigh and hold it in place for several seconds. So if they have the EpiPen, you can help the patient self-administer the medication. And we will go through that practical when we meet face-to-face, how to use an EpiPen if they have one. Shock caused by internal blood loss, bleeding from stomach ulcers, ruptured blood vessels, or tumors can cause internal bleeding and shock. Patients with internal bleeding may exhibit coughing or vomiting of blood. If somebody coughs up blood, it is coming from their lungs, right? So when someone coughs up blood, primarily it's going to come from the lungs. If they vomit up blood, it's coming from the intestines. Abdominal tenderness may be present, rigidity, bruising, distension. Distension is a late sign for the abdomen. There might be rectal bleeding and vaginal bleeding in women. All right, now controlling external blood loss. External blood loss can occur from the capillaries, which are the smallest blood vessels in the body, so that's going to be the easiest to control because they are small and it flows very slow. It can be from the veins, which is the one in the middle, so it can be from the vein, venous bleeding. And venous bleeding is usually dark in its color because it's deoxygenated. It flows steadily, right? So it flows steadily. It's faster than capillary bleeding. So it's going to need to be controlled aggressively. And the one to the right is arterial bleeding. Now, arterial bleeding is the most difficult one to control because the arteries are under high pressure. It is primarily oxygenated, but just keep in mind, if there is arterial blood loss, oxygen is being lost, and if the oxygen is not being replaced, then the arterial bleeding will not be red. It's going to be dark red. So it's going to be the most difficult to control. It mimics the contraction of the heart. So aggressive management is necessary for that. So capillary bleeding, most common type of external blood loss. The blood oozes out. Apply direct pressure to the site. So we're using our dressings and our bandages to control bleeding. It's direct pressure with your dressing, and then you secure it with your bandages. Gonna go through this when we meet face to face. Venous bleeding, second most common type. This bleeding has a steady flow. Apply direct pressure for at least 5 minutes, and the pressure must exceed the flow inside of the vessels for a clot to start forming. For arterial bleeding, this is the most serious type of bleeding. Arterial blood spurts or surges with the heartbeat. Exert direct pressure and maintain pressure until EMS arrive. So direct pressure, place a dry sterile dressing directly on the wound and press with a gloved hand. And you may have to use more than one sterile dressing. Then we wrap the dressing and wound snugly with a roller gauze bandage. Do not remove dressing after you have applied the dressing. Now, the other thing that we can do is direct pressure and elevate above the level of the heart. If direct pressure does not stop external bleeding, from an extremity. Elevate the injured arm or leg as you maintain direct pressure. Now, tourniquets. There are commercial tourniquets that can be applied, and a tourniquet is indicated when traditional methods of controlling bleeding do not work effectively. Not going to be teaching you how to put on a tourniquet, because in 5 days you cannot learn to apply it properly. It's a very dangerous device to use to control bleeding, and if you don't know what you're doing, you can create permanent damage in the patient's limb. So it requires proper training and proper evaluation before you can use it. But there are situations where it is definitely necessary. For instance, a patient with a crushed limb, tourniquet might be very useful for that patient. Patient with an amputation, tourniquet might be very useful for that patient. A patient who has an arterial bleeding, so they get shot in the leg or stabbed in the leg and the femoral artery has been ruptured. A tourniquet might be applicable for that patient. But in order to be able to utilize a tourniquet, you have to go through proper training. It must be approved by a medical director, and the medical director must do evaluation to ensure that you can do it properly. Now, pressure points, we used to use pressure points back in the day. Not a big thing in EMS now, but we still can consider the use of pressure points. So pressure points is used in cases where a wound is too close to the trunk to apply a tourniquet. Prevent blood from flowing into the limb by compressing the artery against the bone. The brachial artery pressure point and the femoral artery pressure point are the most common. All right, now standard precautions is essential when we're going to perform bleeding control. Wear a nitrile or latex gloves. The nitrile is more popular because some persons have allergies to latex. Whenever you might come into contact with patient's blood or body fluid, so always have on your gloves. If you do not get blood on your hands, if you do get blood on your hands, wash it off as soon as possible with soap and water. If you cannot wash your hands, use a waterless hand cleaning solution that contains an effective germ-killing agent. All right, now let's look at the specific wounds. A wound is an injury caused by physical means that leads to damage of a body part. And wounds are classified as either open or closed. If it's closed, the skin is intact, the damage is underneath the skin. All right, now closed wounds, the skin remains intact. The only closed wound is the bruise. This is injury of the soft tissue beneath the skin. Small blood vessels are broken. The area becomes discolored and swells. A simple bruise heals quickly. Now, bruising and swelling may be a sign of an underlying fracture. Right, now for open wounds, an open wound results in breaking the skin. And you have the first one is an abrasion. Now, an abrasion is a scrape, and persons often confuse an abrasion with a contusion, which is a bruise. So an abrasion is an open wound. A contusion is a closed wound. So an abrasion, also called a scrape or road rash or rug burn, occurs when the skin is rubbed across a rough area, surface. What's going on with my slide? Sorry. And we have a picture depicting an abrasion. So that's what an abrasion looks like. Just the top layer of the skin is affected and it results in capillary bleeding. Now, puncture occurs when a sharp object penetrates the skin and may cause deep injury that is not immediately recognized. Puncture wounds do not bleed freely. An impaled object sticks out of the skin. A gunshot wound is a special type of puncture wound. Now, with your gunshot wounds, you have to think about where it entered the body, and if it left the body, is there an exit? And the entrance is going to be small, the exit wound is going to be large. With gunshot wounds as well, the bullet can enter and be redirected to other places in the body. So it can ricochet inside of the body. And no, I don't need to go in that part. Don't want to get too complicated with it. And this is a picture of penetrating trauma or puncture. Now, laceration. Most common type of open wound, commonly called a cut, and it can be a jagged cut or it can be a clean incision. Minor lacerations may require little care. Large laceration can cause extensive bleeding and even be life-threatening. There's an example of that. Now, avulsions and amputations. An avulsion is a wound, is an open wound in which all that is holding the area together is a piece of skin. That's an avulsion. An amputation is when the limb is completely severed. The avulsion, all that is keeping the limb attached or the body part attached is a piece of skin or tissue. An amputation is when the limb is completely severed. So an avulsion is a tearing away of body tissue. If an entire body part is torn away, the wound is called a traumatic amputation. Amputated parts should be located, placed in a clean plastic bag, kept cool. So by keeping it cool, it don't mean you put it directly on ice. You need to wrap it and then put it on ice. Taken to the hospital for possible reattachment. That's what that looks like. Now, principles of wound treatment. Very minor bruises need no treatment. Other closed wounds should be treated by applying ice and gentle compression. So that's for your closed wounds. Rest, ice, compress, elevate, and if necessary, splint. Now, when you're using ice for swelling reduction should not exceed 6 hours. So after 6 hours, you shouldn't be using ice because the ice can interfere with the inflammatory process, which is necessary for healing to occur. So the acronym to remember for your closed wounds is RICES. Rest, ice, compress, elevation, splinting. Stop bleeding as quickly as possible using the cleanest dressing available. Dressings and bandages are applied to control bleeding, to prevent further contamination, and to immobilize the injured area. And of course, we can also use the dressing and bandages to prevent movement of an impaled object. You have various types of dressing. Now I'm going to go into the specifics. So you have different sizes: 4x4, 5x9, 3x3, 10x30 trauma dressings. A dressing is an object that's placed directly on a wound to control bleeding and prevent further contamination. Once a dressing is in place, you apply firm, direct manual pressure on top of the dressing to control the bleeding. And once that is done, then you use a bandage to secure the dressing in place. Now, we use trauma dressing for excessive bleeding. So it's thick and it can soak up a lot of blood. The other dressings are used for minor bleeding. If bleeding continues after you have applied a compression dressing, do not remove the dressing. Put additional gauze pads over the original dressing. Now your bandages. A bandage is used to hold the dressing in place. I have various types of bandages. You have triangular bandages, you have roller bandages, you have elastic bandages, you have adhesive bandages. So you have many types of bandages. Now the principle of bandaging, gonna do this in face-to-face session. Ensure that the dressing completely covers the wound and extends beyond all sides of the wound. Wrap the bandage just tightly enough to control bleeding, but not so tight that it cuts off circulation. Ensure that you assess the distal circulation often and secure the bandage so that it cannot slip. Standard precaution techniques for EMR: wear gloves to avoid contact with the patient's body fluid. Nitrile or latex medical gloves can be stored on top of your EMR life support kit or jump bag, or in a pouch or on your belt. All right, now let's look at specific wounds. Continuing with specific wounds. Now, face and scalp wounds. A relatively small laceration to the face and the scalp can result in large amounts of bleeding because these areas are highly vascular. And what we're concerned about with facial bleeding is the risk of airway compromise. You can control almost all facial or scalp bleeding by applying direct manual pressure. Direct pressure compresses the blood vessels against the skull and stops the bleeding. When you're bandaging the head, you don't want to make it too tight. You just want to wrap it enough to hold the dressing in place because swelling will occur. So anticipate swelling occurring, don't make it too tight. For wounds inside the cheek, hold a gauze pad inside the mouth. Always keep the airway open. Scalp lacerations can be associated with skull fractures or brain injury. If any brain tissue or bone fragments are visible, do not put any pressure on that. Cover it loosely. And if the patient has a possible head injury and you observe fluid coming out of the patient's nose or ears, do not try to control that blood loss, especially if it don't look like blood. Now, with head injuries, the neck and spine may also be injured. Move the head as little as possible and stabilize the neck. So if you suspect head, neck, and spine injury, the patient need to, at all times, move as a unit. Right? So we have to move that patient as a unit, and we try and keep them in neutral alignment at all times. Monitor the patient's airway and breathing and protect the spine. For nosebleeds, nosebleeds can result from injury, or it can be as a result of dry ear or high blood pressure. When controlling a nosebleed, you pinch the nostril and have the patient lean forward. And you may have to do this for up to 10-15 minutes. A nosebleed with no apparent cause is called a spontaneous nosebleed. Management, unless the patient is experiencing shock, have the patient sit down, tilt the head slightly forward, and pinch those nostrils. Pinch both nostrils together for at least 5 minutes. You may have to go over that 5 minutes. And if after 5 minutes bleeding is still occurring, you can put an ice pack on the center of the forehead to cause vasoconstriction of the blood vessels. That can help. If the nosebleed persists or is very severe, then transport is going to be required for that patient. For your eye injuries, when an eye laceration is suspected, cover the entire eye with a dry gauze pad. And you need to cover both eyes. So you're covering the one that is injured and the uninjured eye as well. And you keep that patient flat, because when they are upright, it increases the pressure inside of the eye. If a small foreign object is lying on the surface of the eye, you can use saline solution to flush the object from the eye. For impaled object, we will secure it in place, and as I stated previously, cover both eyes because the eyes work together. Immediately place the patient on his or her back and cover the injured eye with a dressing and a paper cup so that the impaled object cannot move. You can also use a donut. So you can use a triangular bandage and turn it into a donut and put it over the object and secure it. Bandage both eyes and arrange for transport. For your neck wounds, use direct pressure to control bleeding. We don't want to go circumferential around the neck. So I'll teach you how to bandage the neck when we get to the face-to-face session. So you don't want to go circumferential around the neck. That can cut off the arteries that are supplying the brain. In rare cases, you may have to exert finger pressure above and below the injury site to prevent further neck bleeding. Major trauma to the neck may be associated with airway problems and with a neck fracture or spinal cord injury. Maintain the patient's airway, stabilize the head, and neck. For chest and back wounds, place the patient with a chest injury in a comfortable position. If a lung is punctured, air can escape and the lung will collapse. We call that a sucking chest wound. The patient may cough up bright red blood, and as I stated before, if you have a patient that's coughing up blood, it is coming from the lungs. If they vomit up blood, it's coming from the intestine. Cover the open chest wound with an airtight material. It is referred to as an occlusive dressing. That's a fancy term for it. We have commercial type occlusive dressing, but a piece of plastic can be used as a piece of plastic bag, I should say, can be used as an occlusive dressing. If oxygen is available, administer oxygen. Chest wounds may damage the heart, right? So seal the wound and monitor the ABCs. Treat the patient for shock. Perform CPR if it is required. If the patient's breathing becomes more labored after you seal the wound, you may have to remove the seal briefly to allow excess air to escape and then reseal the wound. For your impaled object, apply a stabilizing dressing, arrange for immediate prompt transport. Sometimes an impaled object is too long to permit the patient to be transported. Stabilize the impaled object and carefully cut close to the patient's body. And that's not going to be your task. We're talking about paramedics with the assistance of firefighters. If an object is protruding from the abdomen, do not attempt to remove it. Support the object so it cannot move. Place gauze or towels on either side of the object and secure them with additional gauze. For closed abdominal wounds, result of a direct blow from a blunt object, look for bruises or other marks on the abdomen. Whenever a patient experiences shock, there may be internal abdominal injuries. Place these patients on their back and elevate their legs. Use blankets to conserve their body heat. If the patient is vomiting blood, it may be an indication of bleeding from the esophagus or stomach. Monitor the airway and vital signs. Give the patient nothing by mouth. Arrange for prompt transport. For open abdominal wounds, usually result from slashing with a knife or other sharp object. If the intestines is protruding, we do not put the intestines back inside the patient. This is another situation in which you may have to use an occlusive dressing. So place the patient on his or her back with the knees bent. Cover the injured area with a sterile dressing. Do not attempt to replace the intestines inside the abdomen. Right? So intestines is outside. The first thing you need to do is, if you have an occlusive dressing or a large piece of plastic that can cover it and tape it down. If you don't have a large piece of plastic that you can put over it to maintain the moisture of the intestine, you're going to take a trauma dressing, you're going to wet that trauma dressing and put it over the intestines, and then you put a dry dressing over the wet dressing and seal it. For genital wounds, male and female genitals have a rich blood supply, so injury to these areas can result in severe bleeding. Apply direct pressure with a dry, sterile dressing. Although it may be embarrassing to examine the patient's genital area, you must do so if you suspect injuries. For extremity wounds, apply a dry, sterile compression dressing and bandage it securely in place. Elevate the injured part to decrease bleeding and swelling if there is no fracture present. Splint all injured extremities prior to transport because there may be an underlying fracture. So direct pressure with your dressing and gloved hand. You can use a triangular bandage to secure it, or you can use a roller bandage. And you can improvise. You can cut a person clothing, right? And turn it into dressing and bandage if that's all that is available. So a lot of the management that you will perform as an EMR, you may have to improvise some of the stuff. Now for your gunshot wounds, most deaths from gunshot wounds result from internal blood loss. Gunshot wounds to the trunk and the neck are a major cause of spinal cord injuries. Treatment: open the airway, establish adequate ventilation and circulation. Control external bleeding with dressings and direct pressure. Examine the patient thoroughly to locate all entrance and exit wounds. Treat for symptoms of shock, arrange for prompt transport, perform CPR if the patient's heart stops. For bites, all bites carry a high infection rate or a high risk of infection. Patients should seek treatment for all bites. Minor bites can be washed with soap and water. With major bite wounds, control the bleeding and apply dressing and bandages. For burns, the skin serves as a barrier that prevents foreign substances from entering the body. It also prevents the loss of body fluids. When the skin is damaged, it cannot carry out these two functions. So it can protect the body and body fluids will be lost, which is the plasma. And you have different degrees for burn depth. You have superficial burns, which is first degree, and that's burns that affect only the top layer of the skin. So with superficial burns or first degree burns, it's reddened and painful. The injury is confined to the epidermis or outermost layers of the skin, and the patient experiences minor to moderate pain. An example of that is a sunburn. And the truth is, in the pre-hospital setting, we do not count superficial burns. We only focus on second degree or partial thickness and full thickness. The sad reality is, in Jamaica, we do not have the resources to properly manage a severely burned patient. We don't have that type of resources in the island. And that's why when the guys set up the illegal gas ring or distribution that blowed up, right, in the Mountain View area, the guy, all of the persons that were involved in that are dead. So all of them dead, right? Because we don't have the proper facility to deal with severe burns. Not one of them is alive now. Every single one of them is dead. And when someone dies from severe burns, is one of two things kill them. So if they don't die quickly, right? So if a person with severe burn doesn't die quickly from the burn, if they die after, it's gonna be because of infection and fluid loss. So they developed an infection and they lost too much fluid. If they die early, it's because their airway was burned. Now, your partial thickness burns or second degree burns do not damage the deepest layers. So partial thickness affects the epidermis and the dermal layer. You will see blistering. Fluid loss is not, the fluid loss occurs, but it's not significant. Can be significant depending on the body surface area. They can have moderate to severe pain. Burns are extremely painful, extremely painful. Usually heal within 2 to 3 weeks. Then you have your full thickness. Now, full thickness burns is when it goes through all 3 layers of the skin. And you start to see the eschar tissue where the skin gets leathery. All of that is dead skin, right? So all of that, when it starts to get to that leathery texture, that is dead tissue. It needs to be removed. So it damages all layers of the skin. Pain is absent because the nerve endings have been destroyed. Patients lose large quantities of body fluids and are susceptible to shock and infection. As I stated before, when persons die early from severe burns, it's because their airway is affected. When they die after, long after, or a little after, it's because of fluid deficit or they develop an infection. And that's what killed the guys who were operating the illegal gas circuit, right? So if I can recall from memory, I have the video on my laptop. All of them, I believe, were transported via the police. The police transported most of these guys to the hospital, and the police vehicle wasn't clean, not a clean area to put a burn patient in. They developed infection and eventually died. A microphone is on. JP MFR 2021. Your microphone is on. Do you have a question? All right, I'm not hearing a question, so I'm going to mute that mic. All right, now the extent of burns. When we're calculating burns, or when you have a burn patient, you need to consider the body surface area that is burnt and how deep the burn goes into the skin. So the surface area and how deep the burn goes into the skin. And we use the rule of 9s. This is a method for determining what percentage of the body has been burned. In an adult, the head and arms each equal 9% of the total body surface area. The front and back of the trunk and each leg are equal to 18 of the total body surface area, and this formulation is slightly modified for children. Now it's important for us to know the body surface area, because when this patient gets to the hospital, they are going to need a lot of fluid within the next 24 hours. And how the doctors work out how much fluid the patient is going to need is based on the body surface area and the patient's body weight in kilograms. So this is important information to pass on. And there's a picture depicting the rule of 9, and it is used when the patient have more than 20% of their body surface area burnt. Now note the areas that are different. The head for the infant, child, and adult are different percentages. The lower extremity for the infant, child, and adult are different percentages. All the other areas are the same. All right, now cause or type of burns. You have thermal burns caused by heat. Place the burn area in a clean, cold water. Now be careful with that, right? Now, I won't tell you to put anybody burn limb in cold water. If you suspect thermal burn, you need to separate the person from the source of heat. So sometimes you observe that they're in clothing and smoke is coming from it. You're gonna have to cut off that clothing. If anything sticks to the skin, you cut around it. If it's thermal burn, you don't need to put the area in ice water. And I wouldn't say to put it in any water. Just run the pipe water on the limb, and you're gonna run that water for about 4 minutes. After 4 minutes, you would have cooled the burn. We're cooling the burn, we're not stopping pain. There's a difference, right? So water can't stop pain from a burn. Pain medication stops pain. The objective with thermal burn is to cool the burn, and 4 minutes is the accepted standard for cooling a burn. If you start to exceed 4 minutes of running water on a thermal burn, you're going to cause the patient's body temperature to change significantly, and that's not good for a burn patient. So run the water on the area. If they have burns to their fingers or toes, you need to separate the digits with sterile gauze. And you should have a burn sheet in your EMR kit. So there's a burn sheet or burn blanket that we can cover the patient with if they have a large body surface area that is burned. Try to avoid breaking blisters. Do not put anything, any cream on a patient with severe burns. That will have to be scraped off at the hospital, and that's going to be extremely painful. So don't put no butter, no oil, no cream on the patient burn if it's severe burns. Patients with large burns must be treated for shock and transported to a hospital. All right, for respiratory burns, and this is the one that will kill the patient quickly. A burn to any part of the airway is significant. Look for signs and symptoms. Burns around the face, singed nose hairs, soot in the mouth and nose, difficulty breathing, pain while breathing, loss of consciousness as a result of fire. Breathing problems can develop rapidly or slowly. Administer oxygen and be prepared for CPR. Arrange for prompt transport. For your chemical burns, can be dry chemical, can be acid or alkali, and there are other chemicals. And usually the chemical plants have MSDS documents that outline specific measures that should be followed for specific chemical exposure. If it's a dry chemical, the dry chemical need to be brushed off the patient. So if it's on their clothing, you need to cut off the clothing. And then you brush off the dry chemical, and then you irrigate, run water over the patient. And for chemical burns, it's 15 to 20 minutes of running water on them. For acid and alkali, you just overload the acid or alkali with water. And again, you're looking at 15 to 20 minutes of flooding the area with water. The longer the chemical remains in contact with the skin, the more damage it does. Initial treatment, remove as much of the chemicals as possible. Brush away any dry chemical. Flush with water for at least 10 minutes, and you can go up to 15 or 20. Cover the area with a dry, sterile dressing. Arrange for prompt transport. For chemical burns to the eyes, they cause extreme pain and severe injury. Flush the eyes with water for at least 20 minutes. Hold the eye open to allow water to flow over its entire surface. Loosely cover the injured eye with gauze and bandages and arrange for prompt transport. For electrical burns, the body is a very good conductor, so there will be a point where the current entered the body and a point where the current leaves the body. So the entrance will be small, the exit will be large. And if the current enters the blood vessel, it can pass through the heart. And if it passes through the heart, it can disrupt the electrical activity within the heart, and the patient goes into cardiac arrest. So electrical burns occur when an electric current enters the body at one point and travels through the body, tissues and organs, and exit at the point of ground contact. Electricity causes major internal damage. So everything that it passes through within the body, it's going to burn it up. Patients may experience irregularities of cardiac rhythm or full cardiac arrest and death. And electrocution, depending on the type of current, can cause muscle contraction and fractures. Be certain that a patient is not still in contact with the electrical power source before you touch or treat him or her. Call for assistance from the power company or from a qualified rescue squad. Monitor the ABCs of electrical burn patients and arrange for prompt transport. For multi-system trauma, multi-system trauma is an injury that affects more than one system of the body. You are not expected to diagnose a patient's injury. Several body systems may be injured in situations that involve significant trauma. Be alert for signs and symptoms of injury. And that would bring us to the end of the chapter. In summary, you must take appropriate standard precautions to prevent contact with the patient's body fluids. The three parts of the circulatory system are the pump, heart, the pipes, arteries and veins, and capillaries, and the fluid, blood cells, and other blood components. The three primary causes of shock are pump failure, pipe failure, and fluid loss. Three types of external blood loss are possible: capillary, blood oozes out; venous, bleeds at a steady flow; and arterial, blood spurts or surges. Most A wound is an injury caused by any physical means that leads to damage of a body part. Wounds are classified as closed, skin remains intact, or open, skin is disrupted. Open wounds are classified as abrasions, punctures, lacerations, and avulsions or amputations. Controlling bleeding. Control bleeding by applying direct pressure, elevating an extremity, applying a tourniquet, or using pressure points. Three classes of burns are distinguished based on their depth: superficial or first degree, partial thickness or second degree, full thickness or third degree. Burns may be caused by heat, chemicals, or electricity. And that would be it for now. Not going to go through the questions right now. After lunch, we will go through the question. Hold on. Yes, go ahead.
Yes. Question. You know that there are things that causes the blood to get thin, right? Like medication or